Welcome back. In this lesson, we're diving into a critical piece of the weight loss surgery approval process: documentation and paperwork. The truth is, preparing your paperwork can feel overwhelming. From insurance requirements to doctor's notes, there's a lot to keep track of. But here's the good news. With a little organization, you can simplify this process and avoid unnecessary delays. Today we'll cover why documentation is critical, how to keep your records organized for a smoother approval process, tips for writing a personal letter for approval if required, and staying ahead of the process to help you become well prepared. By the end of this lesson, you'll have actionable strategies to stay ahead of the paperwork game and feel confident in your preparation. Let's get started. First, let's talk about why documentation is so important. Your paperwork serves as proof that you meet all the medical, insurance, and pre-surgical requirements for weight loss surgery. This includes showing medical necessity for the procedure, proving you've completed required steps like supervised weight loss programs, ensuring you're physically and mentally prepared for surgery. Incomplete or missing documentation is one of the most common reasons for approval delays or denials. That's why staying organized is key to keeping your journey on track. Let's break down how to organize your paperwork step by step. Create a dedicated folder or binder. Start by creating a system to keep all your documents in one place. You can use a physical folder or binder with labeled sections, a digital folder on your computer or cloud storage, like Google Drive or Dropbox. If you choose digital, make sure to back up your files regularly. Know what documents you need. Here's a checklist of the most common documents required for weight loss surgery approval. Insurance. Information. Your policy details, including coverage for bariatric surgery. Notes from conversations with your insurance company. Medical records. A letter of medical necessity from your primary care physician or surgeon, records of obesity-related health conditions such as diabetes or high blood pressure, weight loss attempts, documentation of past diet or exercise programs, records from any supervised weight loss programs required by your insurance, preoperative tests, results from blood work, imaging, sleep studies, and psychological evaluations. Personal notes or letters if required. A personal letter explaining why you're pursuing surgery. Having all these documents organized will save you time and frustration during the approval process. Use a checklist. Create a simple checklist to track your progress. For example, insurance policy confirmed. Medical necessity letter obtained. Pre-op test results uploaded. Weight loss history documented. This will help you stay on top of your tasks and ensure nothing falls through the cracks. Keep a communication log. Whenever you speak with your insurance company, surgeon's office, or other providers, write down the date and time of the conversation, the name of the person you spoke with, key details discussed, including any next steps. This log can be invaluable if there are any discrepancies or delays. What to include in your letter? Your letter should address these key points. Your weight loss history. Briefly describe your struggles with weight over the years. Mention any diets, exercise programs, or other methods you've tried without lasting success. Example: I have struggled with my weight since my teenage years. Over the past 10 years, I've tried numerous diets, including calorie counting, low carb, and meal replacement programs, but none have resulted in sustainable weight loss. How your weight has affected your health. Discuss any obesity-related health conditions you're dealing with, such as diabetes, sleep apnea, or joint pain. Share how these conditions impact your daily life. Example: my weight has caused severe joint pain, making it difficult to walk or play with my children. I've also developed sleep apnea, which has affected my energy and overall quality of life. Why you're pursuing surgery. Explain why you believe weight loss surgery is the best option for you. Highlight your commitment to making the necessary lifestyle changes. Example: I believe weight loss surgery is the tool I need to regain control of my health. I am fully committed to following my surgeon's recommendations and adopting the dietary and lifestyle changes necessary for success. Your future goals. Share how you envision your life after surgery, including the activities you hope to enjoy or the health improvements you expect. Example: after surgery, I look forward to being able to hike with my family, sleep without my CPAP machine, and feel confident in my body for the first time in years. Tips for writing an effective letter. Keep it brief. Aim for 1 to 2 pages. Be concise but heartfelt. Be honest. Share your true experiences and feelings. This is your story. Proofread. Check for spelling and grammar errors before submitting. Get feedback. Ask a trusted friend, family member, or even your surgeon's office to review your letter for clarity and impact. Staying ahead of the process. To ensure a smoother approval process, follow these final tips. Submit documents early. The earlier you submit your paperwork, the sooner your surgeon's office can send it to your insurance company for pre-authorization. Follow up regularly. Check in with your surgeon's office and insurance company to confirm they've received your documents and are processing your approval. Be patient but persistent. Approval can take time, but staying organized and proactive will help you avoid unnecessary delays. Before moving on to the next lesson, complete these tasks. Create a folder or binder for your weight loss surgery documents. Make a checklist of all the required paperwork and track your progress. If a personal letter is required, start drafting your story using the structure we discussed today. These steps will help you feel confident and prepared as you navigate the approval process. Getting your paperwork in order is a key step toward achieving your weight loss goals. By staying organized and proactive, you're setting yourself up for a smoother approval process and a successful surgery. You're doing an amazing job. Keep going, and remember, every step you take is bringing you closer to a healthier, happier future.